Well, welcome back. There are some troubling new numbers when it comes to strokes here in our country. Taking a closer look this morning, between 2000 and 2010, the number of people who had to go to the hospital for the most common stroke dropped. That's the good news, but according to the Journal of the American Heart Association, among people ages 25 to 44, the number actually jumped 44%. Dr. Angel Pulido is with the St. David's Medical Center and here to tell us about this study and what is behind this trend. Good morning to you. Good
morning.
I was telling you this is scary because this is my age group, so I want to know what to do to not be in this boat. So let's first talk about this study and what is behind this this new development.
Well, the study kind of looked at a national database of people being hospitalized for stroke. And like you said, one of the good things is that overall people are being hospitalized less. But one of the things that they found was that there was a 44% increase in people ages 25 to 40, which was from one decade to the next. And so that's quite an alarming number. I think part of it is that we're seeing, in younger people, we're seeing more of the common risk factors for stroke. So things like high blood pressure and diabetes, obesity, and high cholesterol. We're seeing that in younger people. Sometimes it's because of a strong family history and genetics. Sometimes it's lifestyle. And then there's other things in younger people that are a little bit, we can see a little bit more commonly. Drug use is a little bit more common in younger people. Certain drugs like cocaine and methamphetamines can be associated with stroke. There's also some other unusual things like tears in the artery that can cause stroke. So I think some of it is our lifestyle, that we're seeing more of the risk factors that we typically see in older people. We're starting to see them in younger people.
So maybe leading a little bit more unhealthy lives earlier on. What can we do to not be in this boat, to not fall into some of these risk categories?
Well, I think, sort of like we talk about heart healthy lifestyles. I think that's something that is very similar for stroke. So things like exercising well, eating well, those are all really important. If you have a strong family history of people having strokes in their 40s, 50s, younger than you would typically think, it's important to talk to your doctor to risk stratify and make sure that you're not falling into some of these categories of high blood pressure and diabetes. It doesn't hurt to stop when you're at the grocery store and get your blood pressure checked and see how it's doing. If you start seeing those numbers go up, then that's when it's important to talk to your doctor to make sure those get treated.
For sure, that annual physical becomes so important.
Right.
I'm surprised to not see stress on this list, because I think that's one of the first things I think of. Oh, maybe more of us are experiencing more stress at an earlier age. Is that a risk factor at all when it comes to strokes?
It's not a direct risk factor. Certainly if you are stressed, people who are younger are usually on the front end of their careers, working a lot, things like that. So that can increase your blood pressure, for example. And so chronic stress may have a little bit, not a direct risk factor, but may have an indirect effect.
Yeah, is the treatment any different depending on if you're dealing with an older patient versus those in this younger age range?
The treatment for stroke is about the same. So we have a very narrow window after stroke symptoms start to try to reverse the effects of a stroke. A stroke happens when a clot will block an artery to the brain, and that area of the brain loses oxygen and blood flow and dies. And so we have about 4.5 hours from when symptoms start to try to reverse that. So that's why it's very important for people to get to the hospital if they ever experience stroke symptoms, to try to get the treatment for it.
All right.
Rehabilitation is also very different for younger people because, as I said, people are in their early part of their career. Often they have young patients, so rehab is really important to try to get them back to working, back to doing everything they were doing before they had a stroke.
Good information. Thank you so much for being here this morning. We appreciate it. We'll have all this information with this interview on our website at kxan.com.